It's, first of all, I just like to get a sense of who they are and where they come from, because I think that's important to then start to work on things that they can relate to. So often they're really keen to get their hands on clinical stuff straight away, and they want to do procedural things, or they want to see babies born, or they want to work in the emergency department or whatever. So I'll facilitate that. But at the same time, I'll try and introduce some other things that I think are important for them to know about working in general practice, and that might include going out with the ambulance men, visiting some of the aged care facilities, coming with me to do a home visit, going out with the district nurse, working in pathology department, or seeing how they take x-rays and following patients through the process of either having a blood test or an x-ray. In my present job, what I've mainly been doing is helping them to consult patients themselves, and also getting them involved in what we do for the community in our outreach services. So going out into the community and providing transport and spending a lot of one-to-one time with the patients, helping the nurse with practical things like dressings or giving injections or putting in eye drops and those sorts of things. But at the same time getting a feel for the whole community, you know, the geography of the place, who these people are, what sort of things make them tick, and what sorts of things bring them to the health service, or what sorts of things might be barriers to them doing that.
Certainly for mentors, it gives you, I think, a breath of fresh air to have someone from, you know, a young person who's enthusiastic and positive to come into your practice, and, you know, you've got to justify your management, you've got to talk about what you're doing. General practice can be a fairly solo, and medical practice in general is a fairly solo thing. You know, you don't work with your colleagues in general practice very much. You tend to sit in a room and talk to the patients, but you don't talk to your colleagues. So having a colleague there just to toss stuff around with is introduced me to, you know, texting and fishing and, you know, stuff that young people do that blokes like me don't. and so, you know, that there are lots of benefits for me, and he's a nice bloke that I wouldn't meet otherwise. So
the John Flynn Scholarship Scheme has sent a number of fantastic medical students to Jabiru, and who've been amongst a host of medical students who've come since I've been here. I think about 16 or 17 medical students in 2 years, one after the other, which is fantastic. I enjoy having the medical students here. It's nice to have some company and people to talk to who perhaps come from a similar sort of educational background. I think it's great help at the clinic, and really I think particularly in the final couple of years of medicine, the medical students out here really do a lot of work. I mean, they're expected to chip in, and every single one of them has been very keen to chip in, and so they end up, you know, seeing a lot of patients and helping with my workload. They come and present patients to me, which means I only probably have to spend half the time with that patient that than I otherwise would. I do have a belief that as you become a doctor, you've been given a lot and you've been taught a lot, and I think you do owe the medical profession something to give some of that back, and I hope all the John Flynn Scholarship holders, I'm sure they will, when they become GPs or whatever they become, they'll end up giving a lot back to the profession too.
I think the John Flynn Scholarship mentoring is quite special, because we have the opportunity as mentors to have a student from pretty much their first year in their course and get to know them really well and follow them through until close to the end of the course and beyond. And in fact, with Ben, I've recently been to Sydney to his wedding and had a wonderful time following. Really, we're great friends now, and that's purely because of the John Flynn Scholarship Scheme, where he had the opportunity to come and see something different in Berry. So I see the John Flynn Scholarship Scheme is quite quite unique in that it allows the mentor to actually become really close friends to a younger colleague and to have some direction in the way their professional lives will develop. And that's somewhat different to other areas of mentoring where you may have a student for 1 year and then you may not see that student ever again. So I think, I'm a strong supporter of the John Flynn Scholarship Scheme for that reason.